Hi everyone, I will continue the talk on migraine. Today I will tell you about some special situations in migraine. Those are migraine in children and migraine in pregnant women. The other day there was a child who came, a 10-year-old who came with history of recurrent headache, one-sided headache, which used to last for about 3 or 4 hours. And during the headache, he would prefer to lie down. He wouldn't like to be spoken to. Sometimes had nausea. And every time he gets up from the sleep after the headache, he would feel much, much better. His mother also gave history of headache, migraine. Now this is a classic case of migraine in children. So how do we identify these patients and how do we treat them? So if you see, the pattern is exactly similar as to what happens in adults. They are the usual precipitating factors like exposure to sunlight and lack of sleep. And in this child, on going deeper into the history, we came to know that this child was sleeping only 6 hours and he was attending many classes. So a child of 10 years, 6 hours of sleep is definitely not enough. He needs at least 8 hours of sleep. And that was probably the trigger in him. And because he was prone for migraine, this started affecting him very frequently. So the other triggers are exposure to bright light and gadgets. And once we tell them, usually they do recover. However, if the symptoms are very frequent, then there are medications which can be given, and the medications are different from that we usually give in adults, and the response by and large is very good. On the other hand, there was another child, 11 years old, whose father had history of headache, but he said that his headache was frequent, that is twice or thrice a week, and every time the headache was very severe on the right side, but it used to last only for a few minutes, 5 or 10 minutes, and then it used to subside. In those 5 minutes, the child said that child was having very severe headache. There was no nausea, vomiting, and there was no sensitivity to light. On going deeper again in this child, so it we came to know that the main issue for this child was attention seeking behavior. So, and he would use this excuse not to go to school on some occasions. So, and the parents used to be very worried, and especially when this anxiety is expressed in front of the child, like talking to the relatives in front of the child and talking about his condition. We went to this doctor, we went to that doctor, we did this scan, and he has. So the child gets more sympathy. So the child gets what he or she wants. So it is crucial. See, if you notice, both these children had only headache, both are of similar age, and both had relatives, parents with history of migraine. The crucial differentiating point was nothing but to go deeper into the history, and the treatment is entirely different for both of them. Okay, so it's very, very important. So unless we are careful at the level of history, we could miss, and unnecessary investigations and medications can be given, and all of us can be drawn into the wrong path. And the investigation modalities also remain the same. So once there is a suspicion, and to rule out, we can do a scan, but most often that isn't necessary. A good history, talking to the child and the parents, Another important thing is many a times it is believed that children won't give the history. The parents come forward to tell the whole history, even though the child is 11, 12 years old. Most often, the child will give you exact history and just listen to the child. That's all. Just ask the parents to hold on for some time and listen to the child carefully, and the child also will feel happy that somebody is listening to them, and somebody is there to help them. That is very crucial. And once the child gets the confidence, you get the exact picture. And once the diagnosis is made, and then at the end of the day, everybody is happy. So this is in short about children and migraine. Now another important condition is migraine in pregnancy. Now in pregnancy, there are two important neurological causes of headache. One is migraine, and another is cerebral venous thrombosis, also known as CVT. Now let's go one by one. Migraine will have the same features as in others. By and large, the migraine frequency decreases during pregnancy. And however, there are a few patients in whom the migraine can become very severe, especially in the first trimester. And as the pregnancy advances during the later stages, so the second and third trimester, the headache frequency reduces. They also have significant nausea and vomiting accompanying them. And the treatment is different because, especially in the first trimester, it is very important not to take any powerful, strong painkillers because it could harm the baby. So the cornerstone of therapy is paracetamol and for medicines to prevent vomiting. So here again, precipitating factors need to be avoided, and that itself many a times reduces the frequency and severity of headache. However, there are a few patients in whom, despite all these measures, they have very severe headache. And in this situation, there are a couple of medications which can be tried. And there are also some injections which can be given over the scalp in case of resistant migraine during pregnancy. Now, coming to the last part, the cerebral venous thrombosis. So, cerebral venous thrombosis is, if unrecognized, is a very dangerous condition, can be life-threatening also. However, the key is, let's say there is a patient of migraine who becomes pregnant, but the headache is entirely different from what she had experienced during her migraine, and it's more severe, intense, then probably we are dealing with something else. And usually they'll have other symptoms like blurring of vision or something with the speech. Speech is not okay and not able to move the limbs. Then it is important for us to rule out cerebral venous thrombosis. And cerebral venous thrombosis is more common in the later stage, second and third trimester. And MRI scan can be safely done during pregnancy. It is eminently treatable provided we identify it early. So that's it. Today we had a short discussion, or I spoke to you about migraine in children and pregnancy. A couple of more things about migraine. Now, there are some other medications of late about this, let's say, newer advances. There is something called transcranial magnetic stimulation, the biofeedback. These also help considerably in migraine. So, there is a whole battery of treatment modalities available. So, there is a lot of hope for migraine patients. So, if you would like to ask any questions, I am happy to answer. Thank you.